Welcome to Porchlight, a presentation of Porchlight VNA and Home Care, providing top-rate, highly personalized care to individuals and families in the Berkshires and also in the Pioneer Valley here in Western Massachusetts. And in order to be involved in the community and provide the highest level of care to your clients, you have to have partners in healthcare. And it really does help, in particular, to have partners who share the same values and have also the similar great outcomes that you have. And an example of that is Mount Carmel Care Center in Lenox, Massachusetts. And I'm very happy to welcome to the program the administrator of that building, George Mercier. So welcome to the program, George.
Thanks for having me. I appreciate it, John.
It's fantastic. And as I mentioned in the intro, there are a lot of similarities. First of all, smaller nonprofit organizations, which we've talked about on the program in the past, that tend to provide, I think, a higher level of care. And also with Mount Carmel, similar to Porchlight, both five-star organizations for their level of care, as evidenced by the rating of the CMS, which is the Center for Medicare and Medicaid Services. The federal government has that system. So congratulations on that.
Thank you.
And also four consecutive deficiency-free surveys from the Department of Health. So the quality is really there at Mount Carmel.
Mount Carmel is a very special facility in that we are the only faith-based in the organization in the Berkshires. And we also have had a great deal of success in terms of outcomes with the Department of Public Health inspections. But I don't really look to the Department of Public Health. I look to the people who live there and who we care for. We have both short and long-term care at the facility. And many of the people who come avail themselves of services like 7-day-a-week rehabilitation. We have occupational, physical, and speech therapy 7 days a week in the facility. So in many cases, people make incredible gains. As you know, as we get older, sometimes we need extended services. It's not quite the same as when we're younger and we bounce back from a hospitalization. It takes a little more time. So one of the things that we can do, because the hospital's under incredible pressure to have people stay a short period of time, is we can give you the full attention and the full service that you need to get back on your feet and get back home again. In addition, for those people who cannot get to that point where they're ready to go back home, we do have inpatient long-term care services. So some people choose to make Mount Carmel their home. Part of being home is having the things that are comfortable, access to your family, access to the community, access to things like church services, access to things that make you feel comfortable and make you feel at home. So when I interview and talk with the people who we're caring for and who live there and their family members, that's where I find out about that 5-star rating. As a technical matter, yes, the Centers for Medicare and Medicaid Services do give us that designation, and we're pleased to join high-quality organizations like Porchlight, another nonprofit, to provide an exceptional level of quality and service to the people of the Berkshires. One of the things we're doing, if I can just jump right ahead and talk about it, is we're going to be doing an event at the facility, and I'd like to invite everybody who's watching or listening to come to Mount Carmel on 320 Pittsfield Road in Lenox, right off the highway, to an event where we're going to have some featured speakers who can help you to answer the question, where do we begin navigating the senior care problem in 2015? So if you're thinking about what's going to happen with mom or dad or aunts or uncles who might not be making it at home, these are things that we can help you to understand, because it's not something that everybody deals with every day. Sometimes we need somebody to help walk us through it. We're very fortunate to have Paula Almgren, who's an elder law attorney, who will be coming in to talk about senior care and planning and the options that people have, which is very exciting because you don't usually get free legal advice, especially from somebody so highly qualified. We also have Marcy Bienvenu, our social worker at Mount Carmel, who'll talk a little bit about the social and emotional aspects of dealing with the need for care and adjusting to the fact that you're getting that care in a facility, whether it be for a short-term or long-term situation. And in addition, we're very excited to have a member of the Carmelite family, because we are affiliated with the Carmelite system. Their mission is to serve the elderly and infirm, is Sister Peter Lillian, who's an ethicist. So we're actually going to have somebody there who's an expert on the ethics revolving around the services that we provide at Mount Carmel. So we're really very excited to have that program happening, and it's going to be held at the facility on October 21st from 5:30 to 7:30 p.m. And it's open to the public. It's free. All we need is an RSVP letting us know that you're coming at the 637-2660. And we'll invite people to come, and hopefully everybody will learn and have some refreshments and have a good time.
And it's something we talk about often on this program because, you know, people don't necessarily get their first foray or step into their first situation with senior care until it's absolutely necessary.
Right.
And at that point, you're already sort of behind the eight ball in a lot of ways because so much is happening so quickly. Mom or dad, you know, they take a fall, they're in the hospital, they need rehabilitation after maybe a surgery or just to stay in the hospital or an illness. And, you know, how do I choose the right facility? How do you pay for it? All these kinds of things that come into play that people, you know, yesterday I had no idea about any of this stuff. Today I'm dealing with it. So to be able to have this conversation, and you know, I would say that that would be a great thing for someone who is actually, you know, older and starting to think about their longer term health in their later years, but also adult children who generally speaking are the ones who often make these decisions
And provide support.
and provide support. Particularly, it seems to be the eldest daughter, who you know statistically is the one, but
Right.
certainly you know either sons or daughters, you know, whoever those decision makers are. This would be a great thing for them to attend.
Yeah, and I think that when you take a look at the numbers, and it's 1.7 million people are availing themselves of nursing facility care. We have over 400 facilities in the state of Massachusetts alone. That you think it might not be happening to me anytime soon, but the truth is 1 in 7 people over the age of 65 will need a nursing facility for some type of care at some point. So even if it's something that doesn't happen to you directly, chances are it's going to happen with someone in your family. And if you have knowledge and information and can help them, you know, with that you can make better decisions. And you can also know things about the quality of the service to expect in the facility, such as the quality that's indicated in the 5-star system. What is that? We've talked about that for a minute, and actually the Medicare.gov website has a lot of information about the 5-star rating system. The 5-star rating system really talks about some of the critical indicators of quality in the facilities where you might receive a service. And you can go on a free website and find out about the quality ratings for any nursing facility and or home care agency. Right. But for the nursing facilities, it's the Nursing Home Compare is the search engine. And, you know, it's the actual Nursing Home Compare website. You can punch in a zip code, and you can actually find out about the nursing homes in the area where you're looking. And that way you can know things like what are the quality results for what's happening in that facility, and what are that facility's ratings? What are the inspections by the Department of Public Health surveyors, who are nurses, social workers, nurse practitioners, and other healthcare professionals who come and inspect these things? What do they have to say about this place where mom might be? How do I know whether or not I'm making the right decision? A lot of those pieces of information are available on the Medicare.gov website under the section called Nursing Home Compare.
I have to say, you know, that's one area, you know, in our world where we make decisions that there is plenty of really real quality information out there. You know, frankly, because the nursing home industry, the skilled nursing industry is very highly regulated in Massachusetts, across the country, but you know, definitely in Massachusetts, and that is the case. And people should, you know, certainly do their research, when it comes to these things. Now, part of doing the research is also understanding what a skilled nursing facility does today, which is different than it may have been certainly 20 years ago,
Oh, sure.
but even 5 or 10 years ago as things continue to evolve. I think one of the biggest changes that people need to understand is that a quote unquote nursing home is not a rest home anymore. It's not that sort of thing. There's really a quality of very hands-on care that's being provided, especially in the realm of short-term rehabilitation. And that's something that Mount Carmel has been focusing on with renovations that have been done to sort of accommodate for that population. And a lot of the work has been, I think, from what I've seen, has been focusing on that sort of gradual evolution of the type of patient that you're seeing in the skilled nursing facility.
Yeah, there's definitely a shift. When you think about nursing homes, people often think about the older model of what was happening in nursing home years ago. But as healthcare is changing and things are getting more and more expensive for the providers to meet residents' needs and people's needs in the area, they're having to take a look at making these nursing facilities more sophisticated. And in fact, there's a major initiative called Interact, which is essentially targeted at keeping people who need care in the nursing facility and avoiding unnecessary hospitalizations. There's actually millions and millions of dollars involved in this initiative because we can provide the very same level of service, minus the emergency room and the operating suite, that the hospital can in terms of things like intravenous therapy, people going to get x-rays, their mobile x-ray technology. We recently instituted a fiber endoscopic swallowing evaluation that can be done in the facility, and there are many other examples where the technical sophistication of the staff in this setting can now provide a level of service that many people might not be familiar with happening in this kind of a center. In addition to the 7-day-a-week therapy, as you mentioned, we've renovated the therapy gym, and we have people who are coming in with quite sophisticated needs for rehabilitation, many of whom are making tremendous progress. And most of the folks who are looking at trying to get back home again are in fact finding their way to back in the community with support. Oftentimes people, when they leave the nursing facility, still need additional support, and that's where we turn to organizations like Porchlight to involve the excellent staff of their organization, and they've recently also achieved that 5-star designation. And just to talk about that in a more specific way, that's the top 10% of healthcare providers in the country. This is not a minor designation. This is a federal standard. It's a benchmark. And to achieve the top 10% status, you must achieve several outcomes and standard measures that are benchmarked against the other facilities. And it really is a hallmark of excellence, and I'm very pleased to be affiliated with an organization like Porchlight that's also recently achieved that 5-star designation.
And when you talk about this sort of continuity of care, at one point we called it the continuum of care. I'm not sure if we still use that term, but anyways, the continuity, because often what happens is you do see several different providers as you rehabilitate, and generally often what you'll see, say someone gets a knee replacement, significant surgery. That means that the person is probably not able to bear weight on their legs for a very long time, which in part necessitates a facility visit, and it does take a long time for that person to heal and then regain their strength and so on. So the 7 days a week and occupational and physical therapy, each of those each day, more of an intense therapy. And then when they're able to go home and become independent, of course, rehab specialists and therapists that will do a home visit to make sure that it's safe. But then that's where the handoff will take place to potentially a skilled home care agency like Porchlight to continue that healing with professional care.
It definitely is great to have medical professionals available to look on you. And of course, everybody wants to be home. and that's the goal that we ascribe to as well. But sometimes there are issues that require chronic care management. And in that situation, I think that the other thing that we offer at Mount Carmel is a high quality of life. People make their own decisions, people have a great deal of autonomy, and they have a very good quality of life. The caregivers there, you know, in our byline is the difference is love. And it, honestly, after working in this field for many years, finding myself in this facility, I can tell you for sure that that is in fact a qualitative difference, that people really do feel cared for and cared about. And I've actually never worked with a team that's been so focused and so dedicated to having the people entrusted to our care get the very best of service every day. And I look forward to getting to the facility every day to find out how we can help to make people's lives better. And that's something that I share with my colleagues and coworkers there. So it's really something very special. If you haven't been to Mount Carmel, you can experience this for yourself. If you come into the facility and you walk through for a tour, which you're welcome to do at any time, you get to know just how nice it is to be in a place where the true caring and support of a dedicated professional staff can make such a difference in the lives of your family member. Or, as I'm getting older, I'm thinking about making that reservation in room 33, you know, even for myself. We're trying to create the healthcare forum for the future where we would feel comfortable being cared for. And I think that we're coming very close to that in the right direction. So I'm very pleased with the progress that we're making at the facility.
And you know, for me, I think, you know, there's a couple of things that I look at. You know, talking about Mount Carmel, you know, Porchlight as a nonprofit organization. We all know that not all nonprofits are made exactly the same.
True.
They're you know, but you know, there's a difference there, and there's a difference between a nonprofit and for-profits, and that literally comes down to how resources are allocated. And to put it quite bluntly, you know, for the nonprofits, those dollars that are in the, you know, quote unquote profit margin, those dollars generally are able to come back into the care in providing either more, you know, staffing or providing high quality, you know, technology, that sort of thing. Whereas, you know, honestly, in the for-profit world, a lot of that goes into stockholders' pockets. So, you know, you kind of have that difference. Now with Mount Carmel, I think even kind of take that next step because of the mission. And you talked about the difference is love, the only faith-based skilled nursing facility in the Berkshires. And I've had opportunities to be at Mount Carmel, and there definitely is a special feel in there that as soon as you walk into the building, you have this sense that it is different, and the focus is a little bit different in just the right way in many ways. And I think that reputation in the community is really powerful, because Berkshire County, as we know, is a very word of mouth centric community as much as any others, but especially in Berkshire County.
I agree with you, John, and I think one of the things that really highlights that in the time that I've been there is that there are many people who've been at the facility before. Maybe they've gotten rehabilitation, maybe they've worked with their doctor to get them home again, and now things have changed and maybe things have declined a bit in the community, and they call us back and they want to come back. And sometimes people come back to stay, and sometimes people come back for a tune-up and to get back home again. But there's a lot of folks who we've seen before that are coming back to us. And that says something about the people's comfort level with being there, and also about the team that's assembled to try and support folks to get to their goals. We work with people so that they know that this is all about them and not about us, so that they have a sense of purpose and mission, and can measure their success and experience their progress as they work with the team. And when people come back, it says a world to us that must be doing something right, because they honestly can vote with their feet if they're not happy with what's going on.
And and looking at your background, you've been in different realms. You've been in sort of big organizations and smaller ones, for profits, nonprofits.
Yeah.
It's got, and you mentioned before that being at Mount Carmel is quite a unique experience. But the direction of senior care, and what you've seen. Tell me about your sort of evolution, and how you started in healthcare. It's been a few years.
Yeah, a couple of years. Sure.
Couple of years.
I'm actually a licensed independent clinical social worker. I got my degree in 1982, so that tells you I've been around for a while. The evolution there was that I worked at North Adams Regional Hospital as one of my first, it was actually my third job. But when I started working there, they started a little 20-bed nursing facility unit. And the fellow that was running North Adams Regional at the time, his name was Patrick Muldoon, said, "George, we want you to be the administrator of this facility." And I said, "What's an administrator?" And here I am 21 and a half years later, still doing that same thing. Partnership between the hospital, nursing facilities, and home care agencies is actually something that a lot of people know about if they've been through the healthcare system. And that partnership is an extraordinary and a very important and vital aspect of the more complex medical conditions. We're talking about strokes, heart attacks, people with Parkinson's disease, people with multiple sclerosis. These are chronic debilitating conditions, as well as your more common hip replacements, knee replacements. These are the places now where when you go to the hospital, you don't stay in the hospital until you're ready to go home. So it's very likely that if you have one of these procedures that you may be coming to the nursing facility for a period of rehabilitation so that you can function at home independently. And that is something that we're well aware of and we're geared up to provide. In my history, once I got into the nursing home side of things, I worked for some of the larger proprietary organizations, and they're very good. I have not seen, that people aren't focused on or trying to do the right thing. But as you mentioned, I think when you get to the nonprofit sector, you start seeing how these facilities in this organization, especially with the Carmelite system, reinvests in the services, in the people, and in the infrastructure so that people are really getting a superior level of service. And that's one of the things that I think sets us apart from all these other places where I've been privileged to be a member of the team. This is really something head and shoulders above in terms of that reinvestment that the organization and support that they give us so that we can provide that quality.
And as you mentioned at the beginning of the program, there is an event upcoming on the 21st. So before we finish, I want to make sure you're able to mention that again. It's really a jam-packed schedule and a ton of great information. It's coming up October 21st.
Right. We're going to be, as I said earlier, doing the program at the facility, and it really will be a great opportunity to get some wonderful information so that whether you need to make decisions now or whether you need to make decisions for you or your family members in the future, that you're kind of armed and equipped and prepared to deal with these kinds of things. No, nobody wants to think about it, but these are things that do happen, and a lot of us have to deal with them. So navigating the senior care in 2015 event will be held at Mount Carmel, 320 Lenox Road in Pittsfield Road, rather, in Lenox. And it's going to be on the 21st at 5:30 to 7:30 p.m. And again, we're going to have attorney Paula Almgren there talking about elder care and her perspective from the legal and the planning perspective there, which is great. And Marcy Bienvenue, the social worker, who's going to be talking about the social and emotional aspects of senior care. And we're very, very excited to have Sister Peter Lillian from the Carmelite Systems talking about the ethics involved, because a lot of times people have issues relating to making these decisions, and what it feels like and what it's like for them to experience this is something very different than us just talking about it here today.
As well, George Mercier, great pleasure having you on the program. I wish you continued great luck and best wishes at Mount Carmel Care Center. Definitely a wonderful organization, and appreciate your time.
Thanks very much, John.
Thank you very much, George. And if you like what you've seen here today and you missed any part of the show, you can watch the entire program on porchlighthomecare.org. Just go under the About section and see our TV show to see the entire thing. So again, thank you, George. And this has been Porchlight, a presentation of Porchlight VNA and Home Care. I'm John Krol. Thanks for watching.